Welcome everybody, thank you for coming. I want to thank Dr. Murat Topoglu for inviting me to do this session today. I'm a very proud recipient of the kindness of WFAS, and this is certainly a wonderful venue that we've got to work with here, and I thank Dr. Topoglu for organising this, and a wonderful assembly of some of the greatest movers and shakers in world acupuncture today. I've been asked if I would talk about allergic rhinitis, and that's what I'm going to do. So I've been in practice for something like nearly 40 years and have been involved in, originally I was a neurophysiologist working on rat brains in the 1970s, and I had a £1 million lab in Bristol University where I was taking rats and sticking pins in them and electrically stimulating them and recording responses from single brain cells in their cerebellum. I found that cruel, so now I stick needles and pins in people instead. But something I've realized that historically the people with power and influence in the world were the people who'd got knowledge, who'd learnt things, the lawyers, the doctors, the priests, who were all highly educated, and knowledge was very rare and very scarce. And so they would make a living by selling their knowledge to the world in one way or another. And of course nowadays we live in a world where information is cheap. So any of you who want to know about allergic rhinitis can go on the internet and find out more than I know in a few minutes probably. So in a sense, what I don't want to do today is talk about, to be a talking textbook and to talk about allergic rhinitis as if I were a talking textbook. So I want to talk about the subject from my own experience of treating it and thinking about it and reading the literature, both the scientific literature and the Chinese medicine literature over the last 30 or 40 years, and comparing that with what actually happens in the clinic. So in this session you'll have my personal conclusions on what I would call the allergic rhinitis puzzle. So we're going to be looking at etiology, both from a Chinese medicine and a Western medicine point of view. We're going to be looking at the pathology as I've come to understand it, and also the treatment. So this is something that I haven't copied from a textbook. This is something that's simply my own absorbed understanding over the years. So we're looking at this from both a biomedical and a TCM perspective. So first of all, let's have a definition. Allergic rhinitis is basically a hyped up, an overreaction of the immune system, of the nasal mucosa to inhaled substances. And this can be pollens, this can be house dust, this can be molds, animal fur and chemicals. So it's any substance that causes a hyped up allergic response in the nasal mucosa. So the typical primary symptoms of this would be sneezing, clear rhinorrhea, clear watery mucus coming from the nose, an itchy nose and eyes, and local swelling and congestion. So we can identify in biomedicine various subtypes of this, different ways that it will manifest in patients. So there's seasonal allergic rhinitis, which of course is happening just at certain times of the year and then will disappear at other times. There's perennial allergic rhinitis, which is a little bit more difficult to treat because it's just there constantly 365 days a year. There's episodic allergic rhinitis, those people who are perfectly okay unless they meet a cat and inhale some of the foreign proteins from cats. And then there's persistent allergic rhinitis, just intractable, never going away year after year after year. So this is one of the commonest illnesses in the modern Western world. In the United States, it's the commonest illness in children. commonest chronic illness in children, and it's the 5th commonest chronic illness in the US population as a whole. And it costs the US healthcare system something like between $2 and $5 billion a year to treat, which is amazing, really. It's amazing that this is such a significant epidemic. But it's a puzzle in both biomedicine and in Chinese medicine. Nose diseases, there were various historical categories of Bing diseases in Chinese medicine related to the nose. There was biqiu, which is a stuffy nose, but that's not the same as allergic rhinitis. So some people say, oh, we've always had this in Chinese medicine history because we've had this condition, or we've had Biyan, which is really sinus infections, but again, that wasn't really the same as allergic rhinitis. That was more to do with infective conditions. And so when I looked into this in the 1980s, early 90s, I found that there was no known reference in modern medicine, in Western medicine, to allergic rhinitis before 1870. And in 1870, a doctor in Kent in the United Kingdom had this himself, and he reported this strange disease that nobody had ever reported before, of seasonal rhinitis, every year having this runny nose. And this has now become a major epidemic, from 1 or 2 people historically to 10, 20, maybe 30% of the population of some countries. So this is a puzzle. What's changed to make this happen in the modern world? So what's changed? So we also need to understand from a biomedical point of view, and also a Chinese medicine etiological point of view, and also that leads on to the question of how do we treat this effectively. When it says to treat a disease, we should seek the root. So we want to find out what the root causes are of this condition. So these are my thoughts on what we learn from the science of allergic rhinitis. And one of the very easy bits of science is looking at which pollens trigger different people. So we'll be responsive to grass pollens, to tree pollens, and other types of pollen. So it's quite useful for us to have this chart in mind. We can look this up on the internet, it's quite easy to find, because my experience has been that once the condition has got going, it gets harder to treat. So my standard approach in treating patients with allergic rhinitis is to say I want to do 4, 6 or 8 treatments in the run-up before the season starts as a preventative measure. So this chart is useful for us to know when we should be doing that course of treatment as a preparatory to prevent problems developing in the first place. But more interestingly for me is to consider the actual biomedical pathology. What's actually happening to these patients and why? So to do that, we can look at the respiratory mucosa, and this is a cleverly constructed pastiche of the cytology of mucosa, and here we can see just these microscopic cilia, and in my faked up model here you can see the cilia more clearly, which are there to move the mucus layer, the thin slippery mucus layer that's supposed to be on the respiratory passages as the so-called escalator effect, dust particles or pollen particles out of the body. So we have to understand that as part of it. Then we have this layer of tissues of columnar epithelium that are cells that form a barrier between external and internal. There are mucus gland cells. Those are the things that are overreacting and producing too much mucus. There's a basement membrane that the tissues grow from. And then in here, this is effectively where the immune system lives. So it's this bit that is becoming inflamed because things from the outside world are getting in to meet our immune systems. So under normal circumstances, this is a very effective barrier to protect our immune system from meeting foreign substances. So this is my diagram showing that foreign chemicals and substances are kind of rejected and don't come to meet our immune. And when I looked into this, I found that the cohesion, the integrity of those membranes, those epithelia, comes about due to various types of protein glue or protein rivets that hold the cells firmly together to maintain the integrity. And these are called desmosomes. These protein rivets that hold things together are called desmosomes. There's other types that are called tight junction peptides that hold everything together. So what goes wrong in allergic rhinitis? And I've thought about this. You won't find this in textbooks. This isn't really something that's discussed in textbooks. This is something that's come out of my looking into the science over. So one thing that's changed in the model is that we now are exposed to solvents to a much greater degree than we used to be. We didn't have petrol engines, we didn't have petrol, we didn't have a petrochemical industry before 1870 or 1890 or so. So people were not exposed to petroleum fumes, and these are solvents. And what solvents do is to dissolve the protein glue, the rivets that hold these cells together, and lead to a loss of integrity of the membrane. So this means that we begin to get gaps appearing in the nasal mucosa that more easily allow foreign substances, other foreign substances, to meet our immune systems. There's the good old house dust mite, which is a ubiquitous thing that we live with, that's in our pillows, in our beds, it's in the dust in our house. And these little fellows eat skin flakes for breakfast. This is what they like to eat, is that they eat dried skin flakes. So they have digestive enzymes that are particularly efficient in dissolving the glue that holds epithelial cells together. And actually, we're exposed to house dust mite feces inhaled into our nasal mucosa are contributing to a breakdown of the integrity of that membrane as well. I don't know whether this is really true, this next one, but to some extent, when we look at the structure of pollens, and particularly some of the more aggressive pollens, they have a very spiky coat. So my hypothesis is that another factor that contributes to the breakdown of the integrity of those membranes is the physical pointiness, the sharpness of pollens. So, and also to some extent, once tissues become inflamed, they become loose, they lose that firmness, they lose that integrity. Anybody who's seen patients with eczema on their skin will know how the barrier function of the skin is lost. So this matters because if we're going to treat an illness successfully, then we need to remove the causality. We need to identify what the causes are, because we can give as much acupuncture as we like. If the patient is going home and is exposing themselves constantly to the very things that are causing the problem, then we're really we're swimming against the tide. So this means that we should be advising patients to avoid exposure to solvent fumes, particularly petroleum fumes, but other solvents as well, volatile organic compounds, paint thinners and those sorts of things, to some extent alcohol. When people say they're allergic to perfumes, I think the main problem with the perfumes is the alcohol, that the alcohol is just enough to start to destroy the integrity of those tissues. I advise patients to do as much as they can to protect against dust mite. That's to say, getting a new pillow and turning your mattress over, getting your wife or your husband to vacuum the mattress every so often, to try and reduce that exposure to house dust mite, and to minimize other allergens that people get exposed to as well. So, to some extent, in Chinese medicine, when we use Chinese herbs to treat this sort of thing, one of the aspects that we have to do is to use astringency, or se, in Chinese, holding the tissues together using substances that have an astringent effect, like wu mei or wu wei zi. Wu mei, wu wei zi. But when the pathogen does get in, when we have a successful invasion of foreign proteins meeting our immune system, then we get those classical responses. We get immunoglobulin E binding to the offending substance and triggering an inflammatory response, triggering TRVP1 receptor in mast cells, and mast cells are there to suddenly have an explosion of inflammatory response. So we get the release of histamine, bradykinins, and a whole cascade of substances from mast cells that then trigger a whole further cascade of inflammatory responses that we won't go into detail now, about cytokines, pro-inflammatory cytokines, a whole party of inflammatory responses. And there is research to suggest that acupuncture works in allergic rhinitis by regulating those inflammatory substances, those inflammatory cascades, particularly the work of John MacDonald in Australia, who's actually far more qualified to talk about this than me, but you've got me instead of him. So, advice? Well, we're at an acupuncture conference, so obviously the advice is go and see an acupuncture practitioner. But actually, in truth, it's probably the best thing you can do. I think it far outweighs the biomedical approach far better, I believe, than pharmaceutical approaches to control of this. So there's also proposed host responses. There's a lot of discussion about the way that some people respond more strongly or more hyperallergenic than others. And one aspect of this is the issue of the way that in the olden days we were exposed to more bacteria as babies and as small children, and that our immune systems had an education that taught us how to tell the difference between a threat and a non-threat, how to tell the difference between Ebola virus and pollen, which is a really important part of the education that we need to have for our immune systems. So there's a strong line of evidence that says that part of the problem with the increase in allergies generally is related to this inadequate training of our immune systems, limited range of bacteria in our microbiota, in our gut microbiome, and particularly there's a lot of interest in the introduction of caesarean section as a widespread medical practice, and of course that removes one step. It removes the first stage of exposure to foreign to the microbiome. So babies get their first dose of bacteria to populate their gut in the birth canal when they're being born, and with a large percentage of children being born without that, already they're starting off with deficiency in their microbiome. Modern mothers in the West are perhaps sterilizing everything too much and having a sterile home. There's epidemiological work that shows that children who are single children in a family are more prone to these allergies as well. And this is because, of course, what children do when they're young is swap snot. Does everybody know the word snot? Snot. Mucus from the nose. Children end up, they're sneezing on each other, they're exchanging microbiomes, they're exchanging their bacteria, and so sharing it, we're sharing our bacterial populations between us. And nowadays, if you're a single child, you're going to be less exposed to that. And then there's the issue of widespread antibiotics, perhaps over-prescription of antibiotics in medicine, and also the use of antibiotics in the food chain for fattening animals more quickly. There's another aspect of the regulation of the immune system, is that in the olden days everybody had intestinal worms. It was pretty ubiquitous, and those worms protect themselves by releasing substances that downgrade immune responses. So actually having worms helps protect against allergic illnesses, and there have been people treated sometimes with very severe allergies, life-threatening allergies, who've been given cultures of worms as a treatment, which seems to be quite effective. So there's a whole lot of other factors, of host factors, in relation to allergies and in relation to allergic rhinitis. We could go on. There's a genetic component. Some people are believed to be more genetically susceptible. And it's been found that if both parents of a child with allergic rhinitis have got an allergic tendency, then it massively increases the likelihood that their child will as well. And a final factor in the immune response is stress as well. Stresses increase our inflammatoriness. Just being stressed all the time increases the levels of inflammatory cytokines in the blood and disturbs the hypothalamic pituitary adrenal axis. So this shifts the body to a more generalized inflammatory state. So advice, besides reducing exposure to house dust mite, reducing exposure to solvent, is to see if we can get patients to manage their stress better by lifestyle and by whatever methods they like to do that. But the interesting thing when we see in clinic, when we see patients, is to try and gauge some idea of which are the important factors in them, because different people will have not one cause but contributory causes, and to different degrees. So it's a part of my intake is to try and get some idea of which are the most important ones, whether stress is a really important one in that individual patient, or maybe stress and house dust mite, or stress and volatile organic compounds, if they're a painter and decorator, for example. So in one patient it might be one snapshot of dysfunction, and another, that graph could actually look different. And so we can adapt our advice for those patients to our understanding of the likelihood of the different aspects. So when we look at acupuncture treatment, or I prefer to use the word acumoxa treatment, as the Chinese do, well, as I say, this is a model. The great strength of Chinese medicine is that we have the accumulated expertise of 2,200 years of a population treating illness using this methodology. And that's what gives Chinese medicine its strength, because we've been treating dysentery, for example, for 2,200 years or more, and we've got an idea of how to treat it well. But with an illness that's new, like this, and when I first went to China to study, I didn't see anybody with allergic rhinitis. It was rare. In 1990, in Shanghai, it was very rare to see anybody with hay fever. In fact, I didn't see anybody. So it means that what's happened is that people have made it up. People have taken the theory of Chinese medicine and they've made a guess at what they would imagine the etiology and pathology to be. And somebody who's done this is one of my colleagues who's unfortunately now deceased, Giovanni Macchiozia, for example. And he wrote a chapter, I think, in this book about the treatment of allergic rhinitis, but it was based on Chinese medicine theory and not in Chinese medicine practice. And the real strength of Chinese medicine is the practice, that actually having done it for so long. So what these textbooks teach is what ought to work in theory. And so they concluded that allergic rhinitis was an invasion of wind cold due to a wei qi, defensive qi deficiency, and so all they had to do was to strengthen the wei qi, tonify lungs, and maybe expel wind cold if you felt that was necessary as well. And we all did this, and it kind of worked with acupuncture. Quite a lot of patients would do quite well unless they were really difficult ones. And the typical treatment that people were doing for this was Hegu, Liechue, Yingxiang, Yintang, these usual points that everybody uses for these conditions. And you get, if with a difficult case, it's maybe 30% or 20% of patients will respond to this. If you get an easy case, it's going to be 70 or 80% of patients will respond to this. That's great. That's good. Sort of. Susanli. So it often gets results. But then we began to notice, and Giovanni Mattiosio began to notice as well, that this didn't always really work very well. So Giovanni's approach was to say, well, it's because the Wei Qi system is rooted in the kidneys, and we need to treat the kidneys as well. And again, that's theory. That's what kind of ought to happen. So he taught that, and we copied that. And that didn't work either very well, I don't think. Still, that basic approach is the one that's been used in the clinical trials, and one of the good things for us as practitioners about allergic rhinitis is that we have a moderately good evidence base. We have quite a good, we've got a set of studies that have been done. We have quite a good systematic reviews of the effectiveness of acupuncture and allergic rhinitis, and so there's a generally positive feeling, and it's generally good, but I want to do better. I would like to really have 95% of my patients benefit, and the difficult ones come to me, and it's difficult to get that 90% using this approach. The research tells us, well, you can make it stronger with electroacupuncture, and that probably helps as well. I did it yesterday. Do you really, is it the best approach to an over-response of the immune system to strengthen the immune system? You know, you're just putting more forces into battle. If anything, you know, in theory, that ought to make it worse at that simple level, because it's not a weakness of the immune system. Most children don't have weak immune systems. They're not exhausted and aged. So the interesting thing, if you're an acupuncturist who also practices Chinese herbal medicine, is the herb test. Is the herb test. Because acupuncture is forgiving. It often works when you don't know what you're doing. We call that medical acupuncture. So acupuncture often works even when done badly, when you miss acupuncture points, when you do the wrong diagnosis, it often works, and that's a problem for us, because that's a problem for getting to truth. And the good thing about Chinese herbs is that if you give a wrong Chinese herb prescription and you treat the person wrongly, it just doesn't work. You know, the message you get from doing bad Chinese herbal medicine is, you're wrong, try again. And so when I use Chinese herbs to treat allergic rhinitis, I found that doing the standard thing of strengthening Wei Qi using a prescription, for example, called Yuping Feng San, it didn't work. It rarely worked. Bloody hell. So basically it was saying, you're wrong. So I kept on trying. I thought, and then you get those special patients who love you so much, they keep on coming back even though you don't get them better. I just love those patients because you learn the most from those. So I've had all sorts of patients. I had Adelheid, a German patient years ago, a lecturer. She had fairly constant allergic rhinitis, sneezing with headaches, and she was driving her mad. And I tried the standard thing, Yuping Feng San, and I diagnosed her with spleen and lung qi deficiency, and she was cold, so maybe she had a bit of light yang deficiency. And it didn't work. And then I noticed, I treated her normally, Chinese medicine standard way, and then I noticed, after a little while, that she was also blood deficient, and I realised that actually, maybe I ought to treat that as well. So I treated blood deficiency, and within a few weeks, she was suddenly a lot better. I used a prescription to remove cold, for cold in the extremities and for cold invasion due to blood deficiency. So I used Dangwei Sernitang together with Bufei-tang, and that worked. So that's something quite interesting. So then I thought, I wonder if anybody else has thought of this. So I looked in the Chinese literature, and I found that there was a Dr. Li Guangzhen in 1993 who researched that. He'd researched giving blood tonic formulas for allergic rhinitis. And so, great, that became part of my approach to the treatment of allergic rhinitis. This patient could have blood deficiency. So this is what the doctor did in his study. He basically used Wu-tang, adding some things to the nose, a blood tonic prescription. So consider blood deficiency. In acupuncture terms, we would use points like Ge-shu, bladder 17, or bladder 20, Pi-shu, maybe Zhusan Li or Sang Yin Chao, 36. And then I had another case where it also didn't work, and then I realized that his lung qi was constrained. And as soon as I realized that his lungs were stagnant, the qi wasn't wasn't expanding, wasn't disseminating, and as soon as I gave something to move the qi of his chest, herbs like suya, or acupuncture points like lung 7, then it worked. So some patients, it's not because they haven't got enough Wei Qi, it's just that it's not being disseminated. So, and then it got really interesting, because I was worried about, I was always puzzled at the beginning of my career about the thing called Yin-Wei disharmony. You all know about Yin-Wei disharmony? Disharmony of Wei Qi and Yin Qi at the exterior. And I had a Chinese medicine dictionary, and I tried to find out what it was in 1985 or something. And then my Chinese dictionary just said, oh, Yin-Wei disharmony, that is the disharmony between Yin and Wei. Oh, thank you. I didn't learn anything from that. And eventually I realized that Yin-Wei disharmony was not about a deficiency of Wei Qi or a deficiency of Yin Qi. It was about the interpenetration, the integration of them, the firmness of them, the way that they hold together. And this is a principle in Chinese medicine represented by this trigram in the I Ching of interpenetration of yang lines and yin lines firmly connecting with each other. And that's when I realized that actually in some cases of allergic rhinitis, it wasn't a deficiency of anything, it was simply a need for integration of yin and yang. I needed to be like a dating agency for yin and yang, bringing things together. And then I began to reflect on what happens when the yin and Wei begin to disintegrate, and the way that the system becomes unstable. So when we have a firm interpenetration, it's like firmness of the epithelia, it's like holding together well, and then you can have a strong external pathogen and it throws it off. Whereas if everything's on the edge of falling apart and the yin and yang are separating, then a tiny, inappropriately small trigger causes a big response. So that's how I came to understand the Yin-Wei disharmony, that something like pollen, which shouldn't make you sneeze like hell, house dust might, dust or cats that should not cause that chaos in our qi system, does that. So I began to add in this idea of chaos, luan in Chinese. And at first when I learned about luan, it was about cholera, for example, huoluan, where yin and yang are separating so much that you're vomiting and you've got terrible diarrhea and you die. There's lower levels of chaos where the system is just unstable. Things falling apart. So what do we do about that? One of the commonest characters in the Su Wen, in the Neijing, is Tiao. And I looked at this character really closely, and that's exactly what Tiao means. It means regulate, but it means regulate in a way that harmonizes opposites, that makes things come back to some level of peace again. And because Chinese medicine came from people ruling the country of China, from the original ideas came from the Warring States period, so a lot of the images are to do with harmony and government and warfare. So the aim of rulers is to prevent chaos in a country, and the aim of physicians is to prevent chaos in the human body, to prevent things from falling apart. So hay fever is an example of that. The classic prescription is Guizhou, which does exactly that. When we look at the herbs in Guizhou, we find that some of them are expanding and are very yang, and you pair them with herbs that are contracting and sour. So in that way we help bring yin and yang together by helping the yang do what the yang does and helping the yin do what the yin should do. So then I thought, well, that's just me overthinking, thinking too much. I wonder if anybody else has thought of this. And yes, I found a textbook of Chinese herbal medicine that was in Shanghai in 1990. And here it was, allergic rhinitis. I translated the section on allergic rhinitis in there. And this is a pungent, scattering herb. This is a astringent, holding together herb. Lulu Tong is a scattering herb at the blood level, and Wu Mei is an astringent herb. So whoever thought of this prescription was a genius. I don't know who they were, but this is a modern, the same thinking. So I think this is an important part of allergic rhinitis as well. It's not the only thing, but it does a similar thinking to Guizhou Tang. So how do we do that with acupuncture? I thought about this. I mean, we could actually do a whole day just on how do you use acupuncture to harmonize yin and yang, but you can do Ren Zong, because that's the meeting point of the Du channel and the Ren channel, and it's there to help integrate yin and yang, to bring them together. That's why, when you go unconscious, if you go into a coma or go unconscious, that's your yin and yang have come apart. And the reason this point is used to revive consciousness is because it brings together, it's the meeting. So with a difficult case of allergic rhinitis, I would do this point here, for example, because for me it makes more sense in terms of harmonizing yin and yang. But we can use other points, Guan Yuan. I particularly like using the points of yin Chao Mai and yang Chao Mai, kidney 6 and bladder 62 in the ankles together, both those points together. So that's how you can do it. We can also do it by our needling method. There's a needling method called Kan Li needling, which harmonizes yin and yang by your needling methodology. The aim being to bring yin and yang together. So conclusions. In scientific terms, allergic rhinitis, the root pathology is to do with loss of integrity of the epithelia due to modern lifestyle changes such as exposure to solvents, and together with the immune regulation that happens with stress in modern life. And stress tends to cause chaotic qi. Stress makes us separate our yin and yang, and that's almost healthy to happen for a moment. If it happens moment by moment through the day for half a second and then we come back to consciousness, that's okay. It's when the stresses of daily life upset our harmony that things become difficult. And in the Han Dynasty, everybody was sitting around having sex, having banquets, having a nice life, and then every so often there'd be a war or a rebellion and people would get killed. But then it would go back to a few years of normal life. Whereas we live in the modern marketing world, marketers, people selling things to us, selling ideas, selling products, the best way to sell them is using emotional responses, by tweaking emotional responses in people. Fear. The main one for selling drugs and selling marketing medicine to people is fear. Fear of cholesterol, fear of your bones breaking, all those things. And so we swim in an environment of people trying to upset our emotional stability all the time. So the other major factor, I think, in the modern world that leads to allergic rhinitis is that issue of having chaos deliberately induced by professionals every day of our lives. We have our yin-yang harmony disturbed, and this, I think, is rather a bad thing and something that we need to deal with in the modern world. Besides this basic idea of allergic rhinitis being due to qi deficiency or wei qi deficiency, that we need to widen our minds a little bit to include blood deficiency, loss of spreading of lung qi, disharmony of yin and wei, and all the things I've talked about today. So, and also finally, before we stop, if you need to get some new patients for allergic rhinitis, here's a way that you can spot them on the train so that you can get them, perhaps give them your card. So basically there's a thing called a nose salute line. If you see a stranger with this line on the nose here, it means that they're suffering from allergic rhinitis. And that's because they tend to do this and get a line along the nose there. It's called the nose salute line. So, thank you very much for having me.
Thank you very much. Give a big applause again.